Hello everyone, welcome to the Rise Talkshow, and today I have a special inspirational guest for you, and you are going to hear things that you have never heard before about how people actually champion in the field and become leaders in the field but not appreciated or acknowledged. Today I'm bringing such a person, Mr. Berlin Alwis, who has started his life as a peer for people living with HIV in Malaysia and became an activist and a support system for them under various NGOs. Till today, he is still being a person for everyone out there who do not have a support system. Let's welcome Mr. Berlin Alwis. Hello, sir.
Thank you.
Thank you for coming here, and thank you for saying yes to participate in this talk show. We are very grateful to have you, sir.
Thank you, Dr. Vino. I was really waiting for this day to come, and today I'm blessed to have this day with you where I can voice up my personal views of the community.
Yes. Let us start from your childhood, sir. Let's tell the world, who is Berlin Alwis? How did he start his life?
My childhood was very to start, I come from a very good family.
Okay.
And I think family support was very important. I had very low education because I couldn't talk till the age of 9.
Oh, till the age of 9?
Just after age of 9, I could talk, and I went to school.
Okay.
So, and then I was always left behind, backward, behind, and things like that. But it was not a thing because people, nurses, teachers and all was very good to me. My family took special interest. That's why I think I'm mama's boy also. So special interest. My mother was very good to me and things. So after that, when I was 9 years old, I had a fracture of my eye.
How? You mean what, sir? Your eye?
My brothers will play bow and arrow.
Okay.
So an eagle stick went through my eye.
Oh my God. And how old were you?
I was, I think, 9 years old.
Okay.
9 years old. So that also missed school and things like that. So my education, I had Form 3 education.
And your eyesight, sir?
I can't see on my right eye.
That means you're blind.
I'm blind, totally blind, one side.
Okay.
But I never told to anybody, and not even much of my family members. They know that I had this accident and thing, but because otherwise they won't let me ride my bike. That's my life. But I'm now very careful. Number 2 is my family has given me full support.
Okay.
And after all that, I have ear problem.
Okay.
I can't hear very well. I had some hearing aid, but hearing aids make it worse. But now I've applied for a new one. They've got some new system.
Okay.
So we use I've just applied to get that. So I've also hearing problem. So I don't really, unless we communicate like this, I can hear you. You can, even if music is on or what, I can't hear the phone ringing or anything. So that's it. So my life was like that. And then when I got to join NGOs, it was much easier to work with and things. So without that was my journey.
Okay, sir. So now I'm going to do a little deep dive on how you actually came into the PLHIV world. Now, I understand. Okay, PLHIV, again, for the audiences, people living with HIV. And HIV is a virus that till today we do not have a cure. I think at this point all Malaysians know what is HIV virus, right? But you did tell me that they are no longer using this HIV term. Why so, sir? What are they using it now in the healthcare settings?
Okay, it's called RVD.
Retrovirus disease. Why are they not using HIV?
Because HIV is considered the stigma. Stigma. So when in hospitals, government hospitals and all, they don't use any more HIV. It's called RVD. And most of the clinic is called ID, infected disease.
Okay.
So with that one, I think people get more understanding and
they won't feel so shy.
Better feeling. They don't feel shy. And if they have the pulses or any other family members there who might not understand, they will not know really what is it. So it's easier for them to adapt.
Okay.
and the doctors do this thing. So we use RVD.
RVD. So now I want to ask you another question. Why is HIV, or why is an HIV person considered a big shame? Why is that a taboo? Why it became a stigma in our country?
It's still a stigma.
Still a stigma.
Still a stigma.
Why, sir? Why?
I think it's our community. And
Okay.
mostly it comes down, sorry to say, it's under the Indian community, it's even more like
Even worse. Even worse. They're still not accepted.
Not accepted. And when they're not accepted, it's very hard for them to get medical support and things like that, or come to a clear understanding. That is where we peers plays an important role, helping them, trying to see how we can do, what are the other NGOs. Doctors and nurses don't have much time to journey them through this journey. So when you don't journey them, they have no confidence. And they have no confidence, they don't have the understanding of what HIV is or RVD is. So they think life is just to go on. And then I transmit it to somebody else. Why bother? You know, things like that do happen.
Yes.
That's it. And then another one thing, it comes to the medical part, medication. There is medication, but most of them are denial.
They are denial. They don't want to go into the medication system.
Medication and things. And medication is not easy today in Malaysia.
Yes.
Though there is access to free medication, but once you deny and you default, you have to buy your own.
They're not going to come give you back if you go back.
They're not going to give you back.
Oh my God! And this is for people to understand.
Yeah.
It's a lifelong. You have to take it every day.
It's a lifelong medication you can take, but if you follow the proper rules and timing, you can live a normal life. But as I said, they are so denial. 2 days they take, after 3 months they are good. The CD4 comes, they just forget about it. Because why? As a peer, where we monitor, we follow, we take care of them. So when they come back to the hospital, CD4 drop, virus load go up, doctor will have to find for us, peer. So as a peer in the hospital, I've been very well recognized by the doctors and nurses in the hospital. Doctors know Berlin. So when the patient comes in and they are defaulted, the nurses don't have time to see them. So they feel depressed, sad, even worse. So that's where we come in. We help them. We do what we can for them.
Sir, now I want to ask you this. Okay, I'm sure at this moment, in this era, still people don't really know how HIV is transmitted from one person to another. And that is the whole reason why it's a stigma. Can you explain how is it actually transmitted? HIV, the virus, how does it get into another person?
It's through sexual intercourse. And also from mother to child. And also drugs, right? Needle. Injection. But now the
trend is fully sexual.
They all, that's it, comes in. So, but the government has taken precaution and things, but the community is still denial.
So, sir, I want to ask you, the main activity a person contracts this HIV, especially in our country, is through sexual intercourse. Data shows, it clearly shows, even though they're not talking so openly about it, last time it was the traditional sexual intercourse between a man and a woman when HIV started. But now we see the data and how it's actually going up. It's through the MSM community. For those who do not know, men having sex with men. Is this true, sir? You are doing this work.
Yes.
Is this
very
true? So men sex with men, the highest contributor.
Highest. And for them, I think it's a trend.
Why is it a trend, sir? Why are they doing it if they know it's risky? And then there's this thing called chemsex, right? And they do it while taking drugs. Can you tell everyone why is this happening? Youngsters are getting it.
Because on social media, you can take one pill called PrEP or what, you won't get it.
Is it confirmed?
How sure you know whether it is
going to work or not?
Because you might go on 2-3 times or forget taking the next pill thing. So it does happen like that. So I think the knowledge is very lacking, especially in our community, the Indian community. There's no knowledge for this. no books written to let them know.
And nobody is advocating
them.
Okay.
Advocating them.
Okay.
So I think this is a very important part in the hospital as a peer when they come in. And mostly now, also a lot of youngsters, they will come in, they get tested, after that there will be denial, they go off, they don't come back.
And do they continue having sex and spreading the virus to others?
They do.
They do?
They do.
Because of denial, they are doing it?
They are doing it.
Okay, so that means when they are going to have sex with someone, they're not going to tell the person, look, I have HIV.
No, they will not tell.
They will just go and sleep.
They will just go and sleep.
And do it.
Do it.
How sad is this, sir? And that is why it's going up, isn't it?
Going up, exactly.
And it's still going up.
It's going up. So when, we come back to this point of it. When the community comes to help them or things, then we find out, we try to help them, talk to them, and then they will give us the problem of the family background.
Okay, such as
depression, and then a lot of them, when they are diagnosed, they go for their life, they don't want to live.
Oh, they want to end their lives.
End their life.
Okay.
Embarrassment, stigma, things like that. So as a peer, we have to understand and be in their shoe.
Yeah.
So as a peer who have RVD and things, we know that we can help them.
So sir, you are a peer because you are also RVD positive. Can you let us know, sir, how was that journey the moment you found out you were positive? How old were you?
I was about 20 years ago.
20 years ago. You were still young. You were still young.
Yeah.
And how did you feel, sir? What happened?
I think,
how was your life the moment you found out?
Oh, that time was very bad. A lot of stigma, discrimination and things. But thank God, there was NGOs in the hospital.
Okay. You had the support.
I had support.
Immediate.
I had immediate support. And I think my time, the doctors was very good.
Okay. So they did not show any stigma or anything. So you were blessed.
I was blessed. I'm very blessed, as I said. So on that part, doctors was good, everything. So I vowed myself to continue helping people and see what I can do.
Because you understand everything. Because you are in it.
Indeed.
But sir, can I ask you something? Even though you had the support, how did you feel inside, sir?
To tell you the truth, of course, you feel down, things like that. And along the way, I lost my best friend.
To HIV too?
Not to HIV. He was to other this thing.
Okay.
So that has brought me very down and to do more help for others. But I think his was a murder case.
Oh, he was murdered?
Murdered.
What happened, sir?
Scam sex.
Okay, can you just explain a little bit? I mean, he took part in camp sex?
Camp sex, yes.
Okay.
And went out, and then after that, he just disappeared like that.
And then found after
a few days, after 3 days.
Oh, so do you think they were participating?
Very sad, yeah.
Oh my God, that's so sad.
all the more I put myself to do what I can do for the community to help.
But sir, at that point of time, I'm sure your physical health was getting worse and you had to take medication. How did you have that energy and courage to just go out and start your work for the helpless?
Family support.
Family support, fully.
100% family support. I come from a very good family. My siblings are very good. My late mother supported me throughout.
Despite knowing you were positive?
Despite knowing this, for them there was no issue. There was no issue. Things like that. So as I journeyed along, I found out more about HIV, how to help people, how to do. So other NGOs offered me to do. I was doing it for free.
Yeah, please.
For free.
Please tell the world.
Nobody paid me anything. I used to travel by my bike all the way. My mother gave me a small allowance and that's it. And then an NGO took me.
And you only had one working eyesight.
Yes,
and you traveled on your bike.
On my motorbike.
So can you enlighten us with some of the true, you have millions of sharing and real life built. Give certain sharings, sir, where you see someone falling dead and having nobody. How were you there for them?
Oh, this was a very, okay. I was one guy. this is a very personal thing, and I think my doctor who was helping him also knew. So he came to the hospital and he went back home. After going back home, he didn't come back for the second visit.
Okay.
So I went to find for him. He was not at his working place. He was security guard.
Okay.
And
Indian, sir? Indian guy. Okay.
Indian, and he was just, I managed to find out where he was staying. He was staying in a room. So I went to the room. He was just lying down like that.
Motionless.
With no help, motionless, urine, all and thing.
Okay.
And then his supervisor was a Malay guy. And then I told him we have to get him to the hospital. He said, cannot, now too late already. And things. So I told him, I put him on my bike.
Literally, he was. You put him on your bike.
On my bike, he was holding me
like this,
like
and then
that, and then I drove him to IPR. IPR. He was admitted. Morning, I spoke to the doctor, and then the doctor said, "Okay." So when I went to see him on the next day, the food was just left there. Nobody to help him, to feed him, and you can't blame the nurses. Also, that time they also thought family members. Nobody. So then after day or two, he just died off like that.
He just died off. And nobody was there?
Nobody was there, no family members, nothing.
So how old was he, sir, at that time?
34.
Very young,
Very young, very
and he
young.
Was all alone?
All alone, and then, but I like to work with other NGOs. I like to share my sharing. So when he died, nobody, nothing, so I called another NGO, help me please. So they managed to go. When we come to Indian community, I tell you very frankly, no Indian community, no support from anybody, especially Hindu Sangam or what. You cannot go to them.
Sir, you cannot go. Why you cannot go? Aren't they supposed to do things for the Indian community?
They won't even look at you.
Why? Because we are dirty? I mean, PLHIV is considered dirt?
Dirt, or, for them, it's
pointless.
Not their problem.
It's like you're saying, you are going to die. Why I need to help you?
Help you.
Is that how you feel?
It's just that simple. So it's not their problem.
That's crazy, isn't it?
And this happens all over. I work for a NGO, Christian-based NGO called Malaysian Care. They are supporting all our Indian people in Klang. We give them food, monthly
they are all RVD positive.
Or RVD positive. Either they are the children or, single parents.
Single parents.
And also, so as a peer, I also help to journey their children to go to school, things by our NGO. It's a Christian-based NGO. No Indian NGO, Tamil NGO is helping us.
And they are all Indians.
Indians.
Look at
all
that.
Indians. Where are we to go? Who are we to ask?
Yes.
So,
and it's their rights, isn't it?
It's their right.
But they're not getting it. And then some just die like that. So, sir, you handle their funerals too?
We handle their funerals. We do everything.
The rites, the last rites.
The last rites and all. What? No choice.
And how do you feel when you do all this every day?
I feel relief.
Because you're giving
I feel
them...
I'm blessed.
You're giving them closure.
I'm closer.
You're giving them
I'm
love.
Blessed. Every morning when I wake up, I feel I'm blessed. So, in between that, I just go along my daily work things. Doctors are very good to me, but I have personal feelings.
Okay, tell us about that.
I'm not recognized now.
Even before, did they recognize you for all this?
No.
The one story you shared is just one. You have millions. You have touched lives every day for the past 20 years.
Yes.
Were you recognized for all this?
I'm not recognized now at all. And even that time. That time you can do, yes, people know you. But today, I think nobody wants to know.
And who are getting all the recognition and awards?
Other people who...
People who are?
Really don't like, those nurses and things like that who knows, I know you, you know me, I give you. Is there. But the down people, so many of us who have gone through this journey have really gone out to do their work, help people, but they are not recognized. And I think today in hospital, I'm blessed to be in the hospital where I am today. That's in Klang. I work with very good doctors, and all of them are new. The MOs, all are new. So when the stop doctor, tell the MO, Berlin has done this, he can help you. They are so good and close and nice to me.
Okay.
And they will come to me. But the same thing when the clients come and they cannot get help.
Okay.
Where are we to go?
Where are we to go? Isn't that the repeating question?
Where are we to go? How are we to help them? So we go to another NGO to ask for help. Sometimes I have to put down my face and go.
Like a beggar,
like a beggar, to ask for help and things. So these are people who need help. We need to help them to see. And we thought help, financial support. We thought you can give moral support, but you need to give them something
to live for. Something to start their medication. Isn't it?
That's it. So what we do is, we do. And at the 11th hour of somebody who wants to, I've saved so many people. That is my proudest part of my life.
So this is what I want everyone to know. Now you are telling me these are people who are now ready to end their lives. We are talking about that. How did you stop them from doing it? You are talking about many, not one. But tell me what you do and what you make, how you make them from stopping to do it.
Number one is put yourself in their shoes. I try to put myself in their shoes. Don't listen what they want to tell. Just explain a little bit to them and feel it. And then make them feel how you went through.
So you talk to them using your own experience.
My own experience. My own experience, what I went through and things. That one guy told me, I cannot live. I went to see the doctor. Doctor told me, I told him, no, I took him to Brickfield, the blind center around there, where in the evening all the blinds will sit down and eat all. I sat down there, I had a cup of coffee with him, and I said, you see their life, they are happy. And so happened that day, one group was laughing and talking. I said, you got everything. You got now today's medication free and things like that. Live your life like that.
And he saw all this,
He saw all that.
Because you
Today
made it happen.
Today is a very good person. You can take his number and just call him and ask him.
Of course.
That's it. That's one.
And he would have died if you weren't there.
Not there. Just 1 hour. Another one was, this guy was in KL Central. 7 o'clock in the morning, KL Central, hanging around. KL Central. The security guard noticed something was not right. So they called for him. They talked to him. So he if you get diagnosed in Singapore, you are thrown out immediately.
Yes. Just like trash.
You are thrown out immediately. Worse than trash. You cannot take out your money. You cannot do anything and all.
And that's your own money. They don't allow you to
They don't take out.
Just because you got the virus.
You cannot. Just because you got the virus. So this boy was stranded for many years.
How old, sir?
He was only 19 years old.
Teenager?
Yeah, teenager.
Oh my goodness.
That's it. So and then I had a call. A call. The security called up MAC, Malaysian Aids Council, and told there's a boy here, he's not this thing and all, but he's got HIV. So MAC called me. Called me. 7 o'clock in the morning, somebody called me. And then I said, I told them, tell where I will be. I went to my bag, I went to see him. When I went to see him, young Chinese boy, that's it. And then he told me, no, I don't want to live, things like that and all. I said, okay, now where you live? So what happens, he said he lives in Klang. I said, okay, I will journey you. I will follow me. Went back to his house, his father. No, I took him to the clinic first to get tests and all. Then,
so he was positive.
He was positive and things. So he called up his father. He didn't want to tell his father anything. So the father came. They're a very good family. It was Chinese New Year time. They gave me one box of orange. I can still remember. But the most important thing, I had a very good sister, nurse, who was helping me. She hugged him and hold him and told him, no worry, you'll be okay.
That is what they want, isn't it? To be touched, to be embraced and not looked at as like a trash.
So this is where we come in. So the sister was very nice and good. She hugged him, hold him. And she was a Malay Muslim lady,
And she did that.
And she did that.
Amazing.
And today he's doing so well. He even bought for me Kentucky Fried Chicken when he comes to see me in the clinic.
And what is he doing now, sir?
Today he's working in one of the advertising firm in KL.
Look at what you did.
And this was also about 5 months back. Another Chinese boy,
young boy too.
19 years old also.
Again, okay.
Also.
This was recently.
Recently.
Okay. What happened?
Slit his hand.
He slit his hand.
Because his family didn't accept. So he didn't want to live. So he was sent to hospital. Doctor called me.
Okay.
Also. Normally the doctors, when they leave their shift in the morning, before they have to handle over, they have to see that who takes care of it. So they called me about 7 o'clock, 7:30, told me such and such person in the clinic, can you please? So I went. So I work with another partner.
Okay.
I think working with another partner is easier to share and things. She's nice lady someone to talk. So I told her, please come help me. We want to see this guy. So I went to see. And we don't have authorities to go in certain zone of this thing. But by our NGO and managed to see who the doctor contacted me. I saw him, nice Chinese boy. And I said, no, he don't want to leave. Let's say his family, and he was crying and things. I couldn't talk much. I said, I'll come back in 1 hour's time. 1 hour's time, I went to see him and he said, Namaina, I will call my sister.
Okay.
So I play always an important role.
Okay.
If you are willing to let somebody know, I will be the middle person.
Okay.
There. I think it's also very important for a peer. If the family can accept another person to be the middle person to help. So it goes two ways.
Yes, of course.
So you keep monitoring him, the family keep monitoring. So I think the family needs more advocacy.
Yes, the family members.
Because they say cannot touch the spoon, cannot drink the cup.
Sir, that's okay. You see, now we are in 2026. Last time, yes, when 1986, that was the first outbreak, and during that time, yes, it was. People were having misconceptions, just like how COVID-19 happened, right? People were thinking, even if I'm near that person, I'm going to get COVID. And it was like that. But now we are in 2026, and people still think that if my skin touches his skin, if I'm sitting like this, I'm going to get his HIV. If I accidentally took something from the same spoon. So this is happening till today.
It happens, but then where we play our role, we
That's
come
when
in,
you come in.
We tell the family, we tell him, no, don't worry, you can live a normal life. But you have to take medication for life.
Yes.
I think the medication part is very, very important.
Very vital. You need people need to take the medication.
And of course, the first few weeks you'll have giddiness, drowsy, side effects. But I think also it plays very important role of the hospital nurses and things like that. And so if they get help and things, so if they know they cannot, then they call us. We can, because I think today it's not like those days. Those days peers was recognized and very important in hospital. Today they all don't recognize peers, sad to say, but I still been recognized in the hospital where I work and my colleague, because we are under an NGO who is very strong and good. So that's it. But I think other places, they still have this problem.
So you see, sir, there are many people like you who's working silently in the field for decades and making a difference in a person's life, like what you've just shared with us. Now, sir, do you think our Ministry of Health is playing enough role in this for the PLHIVs? Based on your experience.
Okay, on my experience, I think from what I experience in the hospital daily when I go, they have trained nurses and not to follow up, MAs and all
medical
to follow
assistants.
up, medical assistants and all. But the lacking is, after 3 months or 6 months, they are transferred out.
You
to
mean
different departments.
Okay, so those who are trained are
they
no
go
longer
to different departments. They are no longer there.
Then what happens?
So somebody else come in.
And it all
come back to square one again. And then that's it. So I've been seeing people for 20 times, 10 times. They are only seeing the nurses first time or doctor first time. Sometimes patient will come in, if it's a foreigner or Malaysian Indian who cannot understand much or what, she said, saya tak tahu, jumpa Berlin, dia tahu apa ubat. The doctor will have to call me. And by heart, so far I can recognize a few of my clients and who are the patients, and then I know what they are taking. So I can help the doctor.
So you are literally like a doctor too.
More, some of them will call doctor.
Seriously, I mean, you are doing more work compared to the healthcare workers for 20 years.
Healthcare workers, I think they can only do their limit.
That's like a limit.
That limit. Other
and you go like 24
we go out
hours.
of the box.
24 hours.
24 hours out of the box. We do home visit. We visit them.
When person calls,
call
you go.
And straight away there.
Despite your one eyesight, despite your own struggles.
And then doctors in the morning, before they leave their shift, they have to call to check. And they will already WhatsApp me. One doctor said, but I feel very happy in my job. When a doctor called me, that means she has the trust.
Yes.
The trust that this person can do it, Berlin can do it. And I know certain doctors will say, Berlin there, we don't worry. Even to today, certain clinics that I've been working with certain doctors, they say, Berlin is there, you don't worry. Even to today.
It's like you're a guardian angel there for all the PLHIVs. It's Berlin's there, don't worry.
For me, I have to be very, very careful because there's only one Berlin.
Yeah.
So his name, we go out in the hospital to the wrong person, but most of them call me uncle lah. So that's it.
So that also, sir, you deal with a lot of young patients, right?
A lot.
Young patients as young as, like the teens. Yeah. So do they, I mean, their futures, I mean, they will be giving up and all that, right? And you're right there for them, right? Every day?
I'm right there, but as I said okay, we have our NGOs, we try to support. Some of them are drug users, things like that. So when they come, out of prison, so they also need support. They are also human beings.
So you mean to say KPM needs to, KKM, the Ministry of Health, they have to do much more, isn't it, for this population? And have more people like you
to come in,
pay you, and so that you train the upcoming peers as well.
I think in KKM, because they have their people, but they have their SOP to follow, that's it. But I think they need to help other sponsor NGOs to come in.
Yes, not
where
only
we can go out of the box.
Right. Because right now, Malaysian AIDS Council, they do get funds from KKM. But it's like it's not being channeled everywhere nationwide. And that is why doctors are depending on peers like you. Nurses come to you. So that's why I said you are actually like a doctor there itself. And the patients trust you more.
The patient trusts us more, yes.
That's
why I said just now, I showed you certain doctors and nurses.
They are messaging
me.
The doctors and nurses.
Trust.
The trust. Because they know Berlin will get it done. Berlin will sort this. This patient is safe in Berlin's hands.
That is 100% sure. And I got something in me when the doctors say, ask to do something, I won't back out or won't say no. We'll go all out to see how we can really help. Even few days back, a patient, a doctor miscommunication.
Okay.
Saw him, after that they come out, but I can't blame them because they are MOs and they are also housemen and things like that. Now, this person was about 40 years old, diagnosed, and he told the doctor he doesn't want to live. He wants to sleep, sleep him off.
So he actually told the doctor.
He told the doctor.
They have this same term called euthanasia, but we don't have it in Malaysia. So he was asking the doctor to put him to sleep.
He was begging the doctor to
kill me, I want to die.
I don't want to die.
Okay.
Then after that, we went to do a assessment on him and all. And then I came back. And then, but his wife was there.
Okay.
His wife was very sporting. She knew, and she said, no, I'll accept him, no problem.
So that's the first time she's finding out.
Yeah. the first time. And the doctor didn't know that she knows.
Okay.
So when I saw the doctor and I told the doctor said, yeah, he told me to kill him. He don't want to live. He's a young Chinese doctor who's a MO. And I said, the wife all do not know. I said, no, the wife is there. So these are the closures where the doctors get from us.
Yeah. I think they are getting the support from you so that they know how to deal with them, because I'm sure they're clueless at some point too.
So in the earlier when I was in other clinics, what the doctors will do is they'll talk to the patient and then they will write a small note, pass it to the nurse to give it to me.
Okay, so that's how they will.
To how they will and then I will basically know what to this thing. So it happens like that.
So sir, you're in your mid-60s now. And you're still you're 65. 65 and you're still out there.
Yeah.
Don't you feel burnt out, sir?
I really feel burnt out. I feel sad that today I'm not recognized also in society.
Of course, you're a human and you will feel such a way, isn't it?
So that's a very sad part lah. But today I still work for the NGO. It's very good, kind and nice to me. But a very minimum.
How much do you
allowance?
get?
$500.
But you do it every day?
I do it every day.
Every morning?
Time. No, 1 week, 3
how
times. How
early do you wake up every day?
6 o'clock in the morning.
And then you take
travel to Klang.
MRT? Yeah. You use public transport?
Public transport now because I don't take my bike nowadays.
And what time do you come back?
I come back about 6 o'clock by that time.
500 for 30 days. 30 days you're doing this.
Not 30
I mean
days,
like a normal working period. Every 5 days a week you're doing this.
3 times.
3 times.
And then in between, but it's considered fine because on call.
Midnight.
But I think also when you work with a group of people, your environment is good. So to me, end of the day, I'm very tired.
Yes.
I don't want to do. But when morning you receive a message, I showed you the doctor how to say no.
Yeah.
And the doctor when asks you, please Berlin help, all the more I feel more sad. A doctor is asking me please to help somebody.
And you cannot say no.
I cannot say no. And I won't say no
you
also.
Won't, because you know you can make a difference. You can help that person right there.
So I think this is where we come in. And then working in Klang is on urban people, mostly onto very low income people, not much of knowledge and things like that. Awareness. So also a lot of young
drug users,
things like that. So education-wise, things like that.
And there's no support, isn't it? They're all Indian communities?
All Indian communities.
No support from the Indian organizations?
No support from the Indian community. Sometimes I feel very shy also.
And if people like you are not there, then what would have happened to these people?
Exactly.
They would have been just dying like flies, isn't it? I mean, this is where we are at today, sir, 2026.
But I think our Indian community should come up. We should bring this up to the center point.
We should.
And voice it out and get who is involved to help out.
Of course.
Okay. Today, Malaysian Care, Christian organization, is sponsoring me and a Malay lady to do our job. They are giving us allowance.
And they are not telling you don't do for Indian community.
Yes.
Right? And they are the ones helping you to do it, isn't it?
They are the ones helping. And they are helping 40 of our
Indian PLHIVs.
People. And then and they are also sponsoring a Malay lady to help out. And the Malay lady knows all the Indian people's name, which I also do not know. So, if they can, even our Indian community can come in and say, okay, today we have a grant for hospital, you can do this. We can go all out. And then if we want to go there, and then they say, my children got education, how are we going to talk?
Yes,
what are we going to tell them?
Right.
Some family don't even...
Yes, look there, sir, and tell what is needed from the Indian organizations, the Indian ministers, the Indian politicians out there. What do you need from them for the PLHIV community, Indian communities, because they are the most vulnerable? What can they do, sir?
Come down, come to the ground. Come to the ground, see what you need. See what we have. What is the problem? Come to the clinic, come to the Indian community, see. Because there is a lot to do. And we need help
and daily an Indian is getting
people
HIV
every day.
every day.
Every day, you know. And don't point fingers or point onto anything. Just it's normal life. Let them live a good life. Let them live a successful life. That is the most important thing.
Yes.
Today I'm successful is because I went all out helping people.
Yes.
I think what your right hand give, your left hand shouldn't know. But keep doing it all, people. I'm very tired, but I love my job because I love my doctors also.
You know, sir, I just wanted to tell you and also everyone, when we talk about success, people usually link it to your properties, how much money you have in the bank, what cars you drive. But do you know what real success is? How many lives you have saved, sir?
Oh, accountable.
Can you sleep peacefully at night?
Today I can.
Right?
Today
can you eat happily?
Today I can. I live a good and simple life, but I have a good life. I'm happy what I did, what I do for somebody.
That is successful right there, isn't it? It's because of all those lives that you have helped, sir. Until today, you're still doing it. You are an inspiration, and today, Malaysia will know who Berlin Alwis is.
And I'm not a healthy person, but I've got faith and confidence in life.
And that is making you stand tall today, right? So now, sir, after sharing all this, who is Berlin Alwis? Tell everyone.
Peer support in hospital HTA. If you go, you just need to ask Sapa Berlin, they will tell you.
Sir, HTA, give the full name. Hospital?
Hospital Tengku Ampuan Rahimah.
Sir, one last message for the new, a lot of people, the new generation, young ones, they're contracting HIV and they are losing hopes. They are thinking of not living anymore. Can you please empower them with your own experience? What would you tell all the PLHIVs, especially those who just found out about their status? What can you tell them, sir?
My take-home message is, don't worry. Whatever has happened has happened. You have hope, have faith, have confidence. Come to us, come to clinic, find a peer, find the doctor. They will help, they can help, but you have confidence. Family will be good to accept end of the day. But you have to help yourself. Don't be afraid, don't do stupid things, don't listen to others. That's the most important thing.
Yes. And you forgot the most important thing. If Berlin Alwis did it, and if Berlin Alwis is a guardian angel for all the PLHIVs, why can't you?
Exactly.
I think that is the message, isn't it?
That's a real message. So, you can live a normal life, can live happy, get married, have children, but take your medication, have good this thing. I think that's, honestly, I have helped a few guys to get married. Today they are living happily with children and things. They also had a lot of stigma and things like that. But we have journeyed along together.
And their children are all negative.
All negative. Right? Very well.
They are doing well, isn't it? So it's not the end.
Okay. Come back to square one. Many years ago, I think class had an Indian support system.
Class is one NGO, right?
NGO, Kuala Lumpur AIDS Support Service. We had an Indian community and a Chinese community to help the Chinese and the Indian. Indian just died off like that.
Just died off.
And if you can revive that, because why? Funding. Don't have funding. So we had a good Indian community. So we went for retreat. We changed talk. Most of them came out. We helped out the hospital, PSR. But when the KKM has cut all the funding, so they cannot survive. Thank God that I could survive for $500. It was okay. I'm from a good family. They help me. I don't pay my rental. My sisters are very good to me, very caring. I get enough for what I want. I'm blessed. But without money, I also need holidays. I also want to go out, enjoy life, But I live within my means and I'm happy. So I take home message, anybody who's listening this, please believe that you can live a normal and good life back.
Thank you, sir. Seriously, today people are going to know who's Berlin Alwis, and we are going to join your journey, and I hope everyone who's watching this today will be empowered to change a person's life, no matter how difficult life can seem. Thank you, sir. Thank you, sir.
Okay.
Thank you for
Most
today.
welcome.
And
I'm so happy I could be here to join you and voice out what I really want to voice out for the community. Though I'm not an Indian, but I work 100% for the Indian community.
definitely, sir. Thank you for that.
Okay.
And you are amazing.
Thank
and
you.
we love you. Thank you,
Thank
sir.
you. Thank you.
Thank you everyone for following us throughout this episode, and I really hope this content reaches out, because there are many souls like Berlin Alwis out there still working in the field to make a difference despite their very own challenges. So let us work along with them to make the world a better place. Don't forget to stream us on all our social apps: Instagram, Facebook, YouTube, Spotify, and TikTok. Thank you, and see you all again. Bye-bye.
Good.